Okay, I arrive on scene. My scene is safe. I got my appropriate PPE on. I got one patient. Mechanism of injury is a gunshot wound to the chest. I will require ALS assistance, and I will have my partner stabilize C-spine in a neutral inline position. General impression of my patient is he is laying supine, appears to be unconscious on the ground. And then I'm going to go ahead and determine the level of consciousness. Hey man, can you hear me? Trap squeeze for pain, stimuli, no response. Patient appears to be unconscious. Okay, I do a trauma strip of my patient. I find my chief complaint, my apparent life threat is a sucking chest wound to the chest. So again, I'm gonna go ahead and apply some pressure to the chest, to the injured area, and I'm gonna apply an inclusive dressing, taping it off on all three sides and leaving room to relieve the pressure on the one side. Okay, so I took care of my apparent life threats. Do I see anything else? I don't see anything else. So I'm gonna go ahead and go into my airway. I'm gonna do a jaw thrust maneuver to open up his airway, and then I'm gonna insert an OPA, measuring it from the tip of his mouth to the tip of his ear. Patient accepts my OPA and airways pan. I'm gonna assess my breathing. I'm looking for appropriate chest rise and fall of his chest bilaterally. Look for that. And then I'm going to go ahead and assess my circulation. Checking my circulation, I'm checking for distal pulses. We got distal pulses. Okay, circulation is there. I'm checking his skin for color, temperature, and condition. He appears to be cold, pale, and clammy. My patient is going into shock, so I'm going to treat him for shock. I'm going to go ahead and install a non-rebreathing mask with 15 liters per minute, treat for shock with that, and then I'm going to go ahead and keep his body, try to control his body temperature by putting a blanket on him throughout my assessment. And then I will make a transport decision on the GCS level of 3, since my patient is a high priority patient, and then I'm going to continue my assessment en route. So next I'm going to go ahead and go into my vitals, take the blood pressure. Blood pressure is 132 over 82. I'm going to check his pulse. Okay, I got a pulse of 70. and breaths of 18. Next, I'm going to go ahead and attempt to get sample, see if I'm going to gather some information, see if we can get some information about this patient as to what happened, if he's on many medications, if he's allergic to something, past pertinent history, last oral intake, and events leading to the present illness. We're going to go ahead and do that. So now I'm going to start my secondary assessment by doing a head-to-toe assessment of my patient. So I'm starting off with the top of the head. I'm checking for any blood on my gloves. I'm checking behind the ears for any bleeding. I'm checking in the ears, in the nose, and the mouth for any bleeding or CSF. I'm checking the eyes for raccoon eyes. I'm also checking the pupils for pupil dilation, responsive to light. I'm checking the nose. I'm checking the upper lip, upper bone, cheekbones, mandible. I'm checking my trachea for tracheal deviation and jugular vein distension. I'm also going to palpitate the cervical spine for any step-offs. Okay. I am checking the clavicles. I'm checking the chest and chopping motion on the sternum. Okay, I'm assessing his ribs for any frail paradoxal motion. I'm also going to check his abdomen in all 4 quadrants. Checking the bladder. Okay, I'm listening for lung sounds. Okay, moving down to the pelvis. I'm going to check his pelvis. Lower extremities, I'm going to check his genitals, do a genital sweep, checking for any blood. I'm moving down to the lower extremities, checking for decap VTLS. I'm checking for a pulse. And I'm checking for motor and sensory, my tapping or scratching, and can you feel me squeezing? Okay, moving up to my upper extremity on his right side, checking for any decap VTLS, checking for my pulse, my tapping or scratching, and can you feel me squeezing? Okay, walk around my patient to the other side. Again, checking for decap VTLS, checking my pulse, my tapping or scratching, and then can you feel me squeezing? Okay, checking my other extremity, checking for decap VTLS. Okay, check my pulse. Pulse is present. Checking motor sensory, my tapping or scratching, and can you feel me squeezing? Okay. So next, I'm going to go ahead and log roll my patient. We're gonna log roll him towards me on a count of C-spine. We'll go ahead and 1, 2, 3. Okay, I'm going to check the back of the head for any bleeding, spinal step-offs, doing a butt sweep, and also checking for an exit wound. Okay, this time we're going to go ahead and put him on the backboard, and into the backboard. Once through, we're going to let him down. Okay, and then we're going to reassess this patient every 5 minutes via transport till we get to the hospital, and I'm done. Woo! 10%.